This is a survey of the dominant waveforms associated with common anesthetic agents. In order to appreciate this, we should first look at a comparison of electroencephalography bands, also called EEG bands. These are listed here on the right for your convenience in order of increasing frequency. Let's go through them briefly. You can use the mnemonic "don't take any stress, be glad" to remember the different band types in order of increasing frequency. So first, the delta band has frequency of 4 or less. It's seen in adult slow wave sleep and also seen in babies. Theta band is next with a frequency of 5 to 8 hertz. This is seen in adults who are drowsy as well as adults who are idling. Next is the alpha band, 9 to 12 hertz. This is seen in people who are relaxing, reflecting with eyes closed, for instance. Next are the spindles. These are also called the mu rhythm or the sensorimotor rhythm, and they have this pattern shown here with a frequency of about 11 to 15 hertz. This is the synchronous firing of motor neurons during rest or during sleep, but inactive motor neurons. Next is the beta band. This is a higher frequency of 13 to 25 hertz. This is seen in people who are actively thinking, focusing, with high alertness and anxiety. Next is the gamma band, which is the highest frequency bands, 26 to 80 hertz. This is the result of multi-neuron populations during cognitive or motor functions, and you can see that it's quite high frequency here. But again, this is the combination of several neurons making this pattern. Next, let's take a look at this table to see the dominant waveforms with each anesthetic agent here. Anesthetic agents are shown in the leftmost column. Next column shows the primary mechanism of action. These last two columns show the dominant waveforms using this as a reference during light sedation and deep sedation to general anesthesia. So less than 1 Mach equivalent and 1 Mach equivalent or greater, respectively. So lighter sedation, heavier sedation to general anesthesia. Let's start with Propofol. The primary mechanism of action of Propofol is GABA-A receptor potentiation. During light to moderate sedation, you'll see primarily alpha and beta waves, so alpha and beta waves here. As you increase that sedation with Propofol, that beta wave will turn into slow delta wave sedation. So the frequency goes down, the EEG bands go slower as you increase Propofol doses. Next, sevoflurane. This has a similar mechanism of action, although a little more complicated, GABA-A receptor potentiation, as well as other things throughout the body. It starts with alpha and slow delta waves, and as you increase the dose, you start to see more of that theta wave as well. So again, getting a slower frequency as you increase that dose. And in general, most anesthetic agents have a slower frequency EEG as you increase the dose. Dexmedetomidine is next. The mechanism here is alpha-2 agonism, so alpha-2 adrenergic receptor stimulation. This one starts with spindle pattern and slow delta pattern, and eventually that spindle pattern goes away at higher doses of Precedex, dexmedetomidine. Lastly is ketamine, and ketamine is notable because it has kind of an opposite pattern. The primary mechanism of action here is NMDA receptor inhibition. So if you have inhibition of inhibitory neurons, ketamine kind of has a stimulatory effect, and that's reflected in some of the unique features of ketamine, like the fact that it doesn't cause respiratory depression, and the fact that it can kind of increase your hemodynamics by increasing your blood pressure, your heart rate, and your cardiac load. This is also reflected in the EEG pattern shown when you give ketamine. So during light to moderate sedation, you'll see beta and gamma waves, and only in really, really deeper sedation with ketamine do you get rid of that high frequency beta band and see that slow delta band.